এয়া আকাশবাণী গুৱাহাটীৰ মহাবাহু আৰু প্ৰাগজ্যোতিষপুৰ
প্ৰাসংগিক
নমস্কাৰ আজিৰ প্ৰাসংগিকলৈ আপোনালোকক স্বাগতম আজিৰ অনুষ্ঠানত শুনক ইউনিচেফ অসমৰ স্বাস্থ্য বিশেষজ্ঞ ডাক্তৰ অন্নপূৰ্ণা কৌলৰ সৈতে হোৱা সাক্ষাৎ গ্ৰহণ কৰিছে মানস প্ৰতিম শৰ্মাই
This episode, we are joined by Dr. Annapurna Kaul, who is a health specialist in UNICEF Assam. Welcome to this episode, Dr. Kaul.
Namaskar.
Today, we are discussing intensified mission in Indradhanush 4.0. Dr. Kaul, if you let us know, what is the need of this drive?
Okay. So now that we are talking about the intensified mission Indradhanush, let me first by saying that we all know and we should all acknowledge that India runs the largest immunization program in the country. And annually, more than 3 crore pregnant women and more than 2.6 crore children up to the age of 2 years receive the vaccination against 12 vaccine-preventable diseases. So coming to the intensified mission Indradhanush, so it has been conceptualized to actually ensure that routine vaccinations or the routine immunization services reach the unvaccinated or the partially vaccinated children and pregnant women. 3 rounds that have been envisaged in the intensified mission Indradhanush. Its main objective is to cover children up to 2 years of age which might have, been dropped out of the routine immunization for the last 2 years. Mm-hmm. So we all understand that for the last 2 years, India has been, or in fact the world has been grappling with the COVID-19 pandemic, and that in some way has put derailed the routine health and routine immunization services across the country. Though we do see that in 2020, during the second half of 2020, when we got some hold on the COVID-19 pandemic, the regular routine immunization services and the regular the health services resumed to some extent, but still it was there was a disruption largely on the outreach sessions, there was disruption on the supply chain, and there was disruption on the beneficiaries reaching out to the patients that were organized for the routine immunization. So in 2022, when we looked at our data of the immunization that has come out from the health MIS or the HIMS system as we call it, we did see that there was a considerable dip in the children that have received full immunization. And if we look at the Assam context of it, so we did see that we reached the full immunization coverage to the extent of only 80%. And if we put it in the figures, so every year almost 7,30,000 children in Assam are eligible to receive immunization. And if we look at the 80% figure, which means only around 5,20,000 received the immunization, rest of them did not receive. So it was a huge figure. So, and if we then collate it for the entire country, so definitely the figures of children up to the age of 2 years that might have missed this vaccination, partially because of COVID and partially because of human resource being engaged in COVID containment, COVID vaccination. So it was a huge number. So looking at our previous experience of Mission Indradhanush, that was done pre-COVID up to 2019-20. So we did see that these campaign modes, when they are done, they do improve the immunization coverage. So that is why now that we are better in terms of COVID-19 pandemic in the country and we have achieved a considerable progress in the COVID-19 immunization as well. So it was a well-thought step to ensure that all the children who might have dropped out of the vaccination, routine vaccination against the 12 vaccine-preventable diseases, they are brought back to the vaccination scheme of the country.
Right. And as you mentioned on this COVID situation, yes, we all know the impact, multiple impact of the COVID-19 situation. But, what are the vaccination challenges posed by this COVID-19 pandemic in the country and specifically in Assam and Northeast?
Right. So you know that like what we have all learned over the last 2 years. So we did see we started with a phase of lockdown, and then that continued to the restrictions and mobility restrictions and to some extent stalling of these health services and some other services in the initial phase of the COVID-19. So if we look at all that, so initially what happened that because of the lockdown, because of the COVID restriction on the mobility, the sessions, usually the routine immunization sessions are held in the outreach, which means in the community. Like we have Anganwadi centers, or in certain places we have schools that become the session site. So these got stalled, or these got stopped for some duration. Again, because of now we also know that Anganwadi centers were closed down, the schools were closed down, the regular session sites closed down as a result of this. So we had to identify the alternate sessions or the locations which might have affected the access to the communities to reach out to these alternate sites. Thirdly, we also know that much of the vaccinators, like we know ANM, Asha Didi or the Anganwadi, who are the regular field workers who are involved in the regular immunization, they got involved initially with the COVID-19 pandemic containment, surveillance, right, identification. Then subsequently they were involved in the COVID-19 vaccination itself. So because of that also, much of the routine immunization sessions could not be held. So we did a planning, but they could not be held because much of the workforce was then diverted towards the COVID-19 containment and vaccination. Again, we do see that there's a lot of fear and a sort of hesitancy on the part of the communities and the families to come out and expose themselves as well as their children while going out to the health facilities or going out to these routine immunization sessions for seeking the services. Also, we did see that because we had now that till time we have 3 phases of 3 waves of COVID-19 that have come, and initial 2 phases were quite severe. So we did see many of the healthcare workers themselves were down with COVID-19. They got infected, and so they also these all things disrupted the services. So all these things, lockdown, restrictions, then closure of the routine immunization session site, then engagement of the workers into the COVID-19 containment, vaccination, COVID-19 vaccination, this and parental and community apprehension, they all led to the disruption in the routine immunization because of the COVID-19 pandemic.
Right. Now coming again to this intensified mission Indradhanush 4.0, which is being implemented pan-India right now. Would you please let us know what kind of changes have been implemented, in IMI?
Right. Okay. So yes. So if we recall, intensified mission Indradhanush was started in 2014. Then it was envisaged to include every child into the routine immunization program, right? But in the intensified mission Indradhanush, what has been done, because we know that this time we have a huge number of children less than 2 years of age and pregnant women who have been kept out of the routine immunization because of the reasons just now we talked about. So there have been certain changes done. So the main change done basically is the focus on the areas that have been left behind because of the COVID-19 pandemic. One. Secondly, those areas which have a huge pocket or the population pocket that are either partially immunized or unvaccinated. Thirdly, it also takes into account the urban areas, particularly the urban slums, the unregistered colonies or the unregistered populations in the urban and the migrant population. Because these are certain, high-risk populations that are always on the move also, and they cannot be or they do not have the access or the, reach to the regular health program per se. So that will be the main focus. Secondly, we also see that what we have, fortunately, the 3 rounds that have been identified for this intensified mission Indradhanush is in February, March and April. So it also coincides coincides with the National Polio Day. That was, we have just seen that in 27th of February. So we have clubbed these two activities to actually do the actual head count survey, going to every village, going to every family, household, to actually count the number of children that may have been dropped out of the routine immunization. And third is basically, we also understand that when we do these sort of, campaign mode sessions, usually they are during the regular work hours, say between 9 to 1 or 2 p.m.
Right.
But looking at the fact that this is a time when many of our, family members and the parents may be involved in their regular work, and then we have certain areas where they will be involved in farming and plantation. So looking at that, there has been a provision of keeping a flexi timing. That means, so on the basis of an area, if the people are not able to come during the early hours, during the morning hours to the session site, so it will be basically planned during the evening hours or even during the afternoon. So if we can summarize it, so the main changes have been like focus is on the high risk areas where there's a huge number of children who have been dropped who are either partially vaccinated or are totally unvaccinated. Urban areas, then actual head counts will be taking place, and thirdly there will be the flexible session timing. And again, there is one more important factor that because we know that there are 3 rounds going to be in the 3 months, and they are going to be uninterrupted 3 rounds of vaccination. That means 7 days are entirely going to be given for routine this intensified mission Indradhanush, irrespective of whether it is a public holiday, irrespective whether it is a Sunday. So all the 7 days. So in February, between 7th February to 15th February, in March starting today, 7th March to 15th March, and in April starting 4th April to 12th April, these 7 days will be totally dedicated for intensified mission Indradhanush.
Right. All right. You gave us valuable inputs, and I hope that the listeners will be benefited largely who are supposed to, get vaccination under IMI. Thank you again,
Right.
Dr. Cole.
Thank you so much. Thank you.
Thank you.
প্ৰাসংগিক শুনিলে আজিৰ অনুষ্ঠানত ইউনিচেফ অসমৰ স্বাস্থ্য বিশেষজ্ঞ ডাক্তৰ অন্নপূৰ্ণা কৌলৰ সৈতে হোৱা সাক্ষাৎকাৰটি শুনিলে। সাক্ষাৎ গ্ৰহণ আৰু প্ৰযোজনা আছিল মানস প্ৰতীম শৰ্মাৰ। সহযোগিতা আগবঢ়ালে অপূৰ্ব মালিয়ে। পৰৱৰ্তী প্ৰাসংগিক শুনিবলৈ পাব অহা সপ্তাহৰ আজিৰ এই একেই সময়তে। নমস্কাৰ।
এয়া আকাশবাণী গুৱাহাটীৰ মহাবাহু আৰু প্ৰাগজ্যোতিষপুৰ